Hello everyone. Today's video is about key implant positions. Whenever you are replacing multiple clinically missing teeth with implants, or you are doing full mouth reconstruction on implants, and if you place implants over these key positions that we are going to discuss, then they serve to support the prosthesis the best. So let's discuss the key implant positions in today's video. There are 4 rules that guide these key implant positions. Rule number 1. The terminal abutments of the prosthesis are key implant positions. Whenever you are using implants to replace 2 or more clinically missing teeth, then the terminal abutments of the prosthesis should be supported by implants. There should be no cantilevers. Whenever there is no choice but to give cantilevers, like in an all-on X prosthesis, then have a look into patient's force factors, masticatory dynamics, crown height space, bone density, the opposing arch, and whether you can place implants over key implant positions. If your patient is an old age female with a good bone density, where crown height space is not high, where you can place implants at all the key implant positions, a patient who does not parafunction and who has an opposing dentition that is a complete denture, then in such patients you can give cantilever, the length of which is 2.5 times the AP spread. As you know, the AP spread will be the highest in tapered arch form, next high in ovoid arch form, and the shortest in square arch form. But if the patient's force factors are high, if they parafunction, if they have a low bone density, if you cannot cover all the key implant positions in these patients, if the opposing dentition is an implant supported fixed prosthesis or a sound natural dentition, then in these cases you have to reduce or eliminate the cantilever length. You have to increase the implant number, you have to increase the implant size, you have to increase the implant design surface areas to be able to support the prosthesis. Rule number 2, no 3 adjacent pontics. You can use 2 implants to replace 3 clinically missing teeth at terminal positions. You can also use 2 implants to replace 4 clinically missing teeth with 2 implants acting as abutments at terminal positions only when the force factors are low and the bone density is high. If you are replacing 5 or more clinically missing teeth, then you have to add more implants to replace the clinically missing teeth, since you do not need more than 2 adjacent pontics in the prosthesis. Rule number 3. Canines and first molars are the most important key positions. That is, if you are replacing multiple clinically missing teeth that also involve the canine positions or the first molar positions, then you need to place implants in the canine positions and the first molar positions, whether or not they are the terminal abutment positions. Rule number 4. Every arch is divided into 5 segments. When you are replacing more than one segment, then key implant position is at least 1 implant in each segment of the arch. Remembering to place implants according to these key implant positions will help you place the implants in a prosthetically driven manner. It will help you to plan a prosthesis that will be best supported by your implants. I hope you enjoyed the video. For more such educational videos, stay connected to my YouTube channel. This is me, Dr. Sanyogta, signing out.